Hello everybody, I'm Brian LePay with another edition of the Ocean County Health Department's Health Headlines. Today our topic is about the very serious public health issue surrounding teen and youth suicide that is gripping our nation and its impact here in New Jersey and of course Ocean County. Here to give us a little better understanding regarding this emerging issue is Kimberly Riley, our Drug and Alcohol Director. Kim, thank you for being here.
Thank you.
Kim, this is a serious issue that I think a lot of people don't know about.
Absolutely. And I also think it's really hard for people to reconcile the idea of a child, a youth, a high schooler, and the idea of suicide. It's really hard when you think about this time in somebody's life, especially as an adult. This stress-free time, you're going through school, and you take this happy little child and think that they could be depressed or anxious or having suicidal thoughts. I think as a society, sometimes it's really hard to take a step further and look into it. But the data definitely supports that it is unfortunately happening in Ocean County, the state, and the United States.
It certainly does. And speaking of data, I would like to share some statistics. 14 young people died between the ages of 10 and 24 in a period from 2013 to 2015 right here in Ocean County. Now the state total for that age bracket is 283. And one more important statistic I think I have to share is that Ocean County had one of the 3 highest rates in the state for suicide attempts and self-inflicted injury.
Yeah.
Once again, Kim, what are some of the many causes? What's going on here? What's the cause for these numbers?
The youth today are living in a world that none of us have lived in, right? So they are growing up in a post-9/11 America. Parents are a lot more vigilant. We're a lot more concerned about the safety than we ever were. School shooting drills are a reality as young as my daughter in preschool had them,
Right.
and that is something we didn't have to contend with when we were growing up. It really changes the dynamic when schools were the safe place, that you have that fear of school shooting, and you see that during these drills. You have these youth that are what we call digital natives. They've grown up with a telephone, with a tablet, with a computer, and with that is social media. And social media has completely changed the way that our youth communicate with one another.
Yeah.
They are constantly having information and stimulus, if you will, from the different accounts coming at them. They have text messages or direct messages or their Twitter or Instagram, Facebook, and they're constantly on. When do these youth ever get a chance to reset and be away? Their brains are constantly firing from this different stimulus, and coming from that social media account. It's really hard to be a youth nowadays, in my opinion, because you never have that safe place to just kind of go and be away and not be on for your peers.
That's an incredible,
Yeah.
incredible message right there. And you're right, the kids never get to just be children anymore.
Yeah.
There is so much pressure. Talk a little bit about how there are other issues surrounding the suicides. You know, there's divorce in families, there's bullying on
Yes.
social media. There are so many different factors that come
Yeah.
into play that would get a child to start seriously thinking about taking his own life. And it stems with
Yeah.
all that friendships,
Yeah.
relationships.
I mean, every case where a child has depression or anxiety or suicidal ideation is going to be different. We're never going to know the factors, but similarly to how I said, a teenager today, a youth today is nothing we've ever experienced. The whole family dynamics also changed.
Yeah.
Divorce is a very high percentage of marriages nowadays. Both parents have to work many times. You might see an older child coming home to an empty house.
Yes.
We also know, now I work alcohol and drug in the field of prevention, we know family dinners are huge, but when parents are working late or working weird hours and you have sports on that and everybody's just constantly going and never sitting down for dinner and never having that family piece, we definitely live in a world of go, 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 and you kind of miss that, like I said, like the social media, just coming down together. So everything's different in 2019 than from what we grew up in, and it's a reality that the stress, the anxiety, and the depression are going to be a reality for our youth.
Yeah, and I think identifying some of those symptoms, identifying the suicidal tendencies, because we don't have that family hour anymore, so maybe you don't get an opportunity to see your child maybe falling into a depression, withdrawing. Talk about some of the things that as public health officials we're trying to do to solve this problem.
Well, we're all about education for our community. So bringing awareness to this topic, like we talked before, it's kind of a hard topic to bring out into our communities to say this is a reality of what's happening. In fact, I want to just touch on the New Jersey poison information. Since 2018, we've had 100 preteens attempt suicide by drug overdose. And just here are these numbers: 3 cases of 9-year-olds, 7 cases of 10-year-olds, 22 cases of 11-year-olds, and 68 cases of 12-year-olds. And 80% of that was females. You need to know that this isn't even just a teenager issue. When we talk about youth suicide, we're talking as young as 9 years old, an attempt of suicide. We really need to make sure that our families, our guardians, our teachers are looking at things when they see a change of behavior. Look at the messages that are being reported, and not just the verbal ones. Check the social media accounts. Check to see what's being said. See if the friends are indicating anything through text message that is off. It is so important that you look for those changes in behavior and don't let things just sit. If you see something different, you need to act on it, because unfortunately the numbers are there that this is happening, and we want to make sure that everybody's aware of what to do. So go to a doctor, go to your pediatrician and talk to them. Talk to a psychiatrist, talk to a counselor, talk to the staff in the school. Get the help that's needed, because this is a reality, unfortunately.
Now, if you are a friend, a loved one, a parent, and you do see these signs, you do see these symptoms, what's the first thing that they should do? You mentioned going to, seeing their pediatrician, but I mean, if it's something urgent, what would you do at that point? Get to the phone? What do you do?
Get to the phone. If you identify a plan, a method, you definitely want to make sure you get to the phone. There are psychiatric screening services at the local hospitals. They're able to do youth psychiatric screening for the urgency of those issues. So you definitely want to make sure that if you see something or you identify a solid plan for an attempt of their life, that you move forward immediately.
Yeah, I saw a lot of people, a lot of parents thought, I saw some of the signs and I didn't react quickly enough. So. Okay, Kim, thank you so much for all that information. That's going to do it for now. If you're looking for more information on youth suicide or any of the services and programs we offer here at the Ocean County Health Department, please visit our website at www.ochd.org or follow us on Facebook and on our YouTube channel. That's going to do it for now. I'm Brian LePay. Thanks for tuning in.